Hi, my name is Cameron and I'm going to be your physician assistant today. The purpose of today is to perform an abdomen and a musculoskeletal exam. First, I'm going to ask you to use the restroom if you need to. If not, great. I'm now going to ask you to take off your shirt, shoes, and socks so that I can wash my hands. Okay, and now I'm going to go ahead and have you lay down for me with your knees bent and your arms down flat by your sides. And do you have any pain today? Any pain in your abdomen area? Nope. Okay, perfect. So now, since I've made sure that I've exposed the patient from the xiphoid process to the symphysis process, I can go ahead and start inspecting the contour of the abdomen. Contour of the abdomen for, how did I forget this? The contour of the abdomen for striae, scars, distension, pulsations, masses, and the condition of the umbilicus. Okay, and now I'm going to go ahead and auscultate. So I should grab this, my stethoscope. I'm going to auscultate with the diaphragm. I'm auscultating bowel sounds. And I'm going to note if the bowel sounds are normal active, hyperactive, or hypoactive, and I'm auscultating in all 4 quadrants. Okay, and now I'm going to go ahead and percuss the abdomen, or I'm going to percuss in all 4 quadrants, noting for sounds of tympany or dullness, and then I'm going to also percuss for splenic enlargement. Okay, so I'm going to go ahead and percuss, going in all 4 quadrants, and then for splenic enlargement. So I'm just going to go ahead and have you take in a breath and just breathe in and out for me. Okay, perfect. Now I can palpate. So first I'm going to palpate lightly with one hand, going about 1 centimeter deep, in all 4 quadrants, looking for signs of any distress or superficial masses. So again, just one hand, going about 1 centimeter deep. Sorry, my hands are cold. Okay, and now I'm going to go ahead and percuss deeply with 2 hands, going about 4 centimeters deep, covering all 4 quadrants, looking for any signs of distress or, sorry, this hand is colder, signs of distress or deep masses. Okay, and now, yeah, I asked you about pain. Okay, so now I'm going to go ahead and palpate palpate the liver. So I'm going to take my, for enlargement, masses, or tenderness, and I'm going to put my left hand under your right rib cage and lift up a little bit. Use my right hand, put my fingers at your face, and go under your right anterior ribs cage. So I'm going to have you take a deep breath in and hold it. Okay, and you can breathe out. Perfect. And now I'm going to palpate for splenic enlargement. Same way. Left hand under the left rib cage, and go ahead and breathe in for me. Okay. No tenderness or enlargement there. So now I can go ahead and have you sit up and with your back face me. So swing your legs over there. I'm just going to go put my stethoscope over here. And I'm going to palpate for CVA tenderness, using one hand, and then giving you a hard tap by your, first your left 12th rib, and then I will do this bilaterally. Okay. No pain there, and then I'm move bilaterally to the right side. No pain there, perfect. So since you're already sitting up, oh, and I would perform a rectal exam at this time. So since you're sitting up, I'll go ahead and have you stand up. And as I move to the musculoskeletal exam, so for the musculoskeletal exam, I am inspecting and palpating for a lot of things. Symmetry, signs of inflammation, edema, effusions, bone deformities, malalignment of bones, crepitus, atrophy, range of motion, and abnormal movements, and then the condition of surrounding tissue. So first I'm inspecting the spine, posterior and anterior posture, noting the alignment of the shoulders and the pelvis. Everything looks good. And then I'm also going to inspect the spinous process, as well as the scapula, and then the clavicle as well, I think, or just the scapula, the trapezius, and the sacrum. So, and the paravertebral muscles as well. And then I'm going to go ahead and inspect the posture laterally, making sure that there's no lordotic or kyphotic curvatures. Everything looks good, so I can go ahead and palpate the spine. I'm going to have you turn your back towards me. I'm going to go ahead and palpate the spinous processes, and then the paravertebral muscles bilaterally, the sacrum, the scapula, and the SI joint. So right here. Okay, now I'm going to go ahead and we can move on to the cervical range of motion. So I'm going to go ahead and have you look down at your toes and then look up. Okay, flexion and extension look good. And then go ahead and look over your left shoulder and your right shoulder. All right, rotation looks good. And then go ahead and push your left ear to your left shoulder and then your right ear to your right shoulder. Lateral bending looks good. Don't need a chiropractor. And okay, so now we can go ahead and move on to the lumbar spine. I'm going to go ahead and what do you call it, to your hips, stabilize your hips. So go ahead and try and touch your toes. Okay, perfect. And then bend backwards for me. Perfect. So flexion and extension look great. And now I'm going to go ahead and have you twist to the left and twist to the right. Okay. Rotation looks good. And then go ahead and reach down your right arm towards your right leg. Okay, good. And then other side, lateral bending. Perfect. Okay. Now we can move on to your upper extremity. No, mandibular joint. Okay, so go ahead and open and close your mouth. Okay, and go side to side for me, and then stick your teeth out as far as you can, and then put them back as far as you can. Okay, we're doing great, guys. All right, and okay, now we can move on to upper extremities. I'm inspecting the clavicle, the scapula, the AC joint, the medial lateral, no, not yet. We're doing the proximal humerus, and I said the AC joint, and that's it. So now I'm going to palpate those areas as well while I'm here so that I don't forget. So clavicle, AC joint, the scapula, I should probably take a look. Okay, and then proximal humerus and radial humerus, right? That's where they are.
The arm, the biceps, the triceps.
Yes, so I have to do that too. So next I'm inspecting the upper arms, the biceps, the triceps, the medial and lateral epicondyles, as well as the acromion and olecranon process. I'm also going to palpate those areas while I'm here bilaterally. So starting with the upper arm and the biceps and triceps, and then medial, lateral epicondyles, good, and then the olecranon process. And then I'm going to go ahead and move on to the forearms. So I'm inspecting the forearms. I'm inspecting the medial and lateral, or no, the radial and ulnar styloid processes, as well as the carpal bones. Okay, so now I'm going to palpate those areas. So forearms, then we have the radial radial and styloid processes, and then we have the carpal bones here. And now I'm going to go ahead and inspect the hands and the wrists. So I'm inspecting the metacarpal joints, the interphalangeal joints, the I don't know what what's happening. And I'll figure out the rest while I go. So I'm gonna go ahead and now just palpate the hands. The anatomical snuff box. So you're palpating MCP. What? Okay. And wait, what am I doing?
MCP
joints. The MCP joints, the anatomical snuff box. Lovely. And the these are the
interphalangeal.
These are the interphalangeal joints up here. Something was here, but I forget the name. So I'm inspecting the interphalangeal joints, and gonna palpate those. Don't know what I missed, but
Your MCP joints. These are
Yeah.
your MCPs.
The
Here.
MCPs. Okay.
Yeah, you
Let's
said
pretend
them.
I did those. Okay.
You did them.
Now that we've done that, we can go ahead and start with the shoulders. So sorry. Range of motion in the shoulders. I'm gonna go ahead and have you lift your arms up and behind if you can. Okay, now cross them. Or no, that's flexion and extension. They look great. And then lift your arms to the side. All right, backwards. Great. Didn't know that one. Side, and then yes, and then cross them for me. So abduction and adduction look good. And then I'm gonna go ahead and have you do like a robot. Okay, and then internal and external rotation. And then I'm gonna have you circumduction. So go ahead and go like that. Okay, perfect. Put your arms in circles. And then now we're gonna move on to the elbow. So go ahead and hold your hands like you're a server. And you're gonna go ahead and extend and flex your elbows like that. Perfect. And then go ahead and put your hands to the floor and then back up towards the ceiling, and pronation and supination look good. And then go ahead and we're gonna move on to the wrist. Keep your hands like that. Go ahead and point your fingers towards yourself and then down to the floor. Perfect. And then I'm gonna have you put your fingers, your pinkies towards each other and then away from each other. Okay, that looks good too. And then I'm going to move on to the fingers and the thumbs. So go ahead and ball your hands in a fist for me. Perfect. And then you can release. Okay, flexion looks good. And then go ahead and extend your fingers like that, point them towards the ground, and you can go ahead and spread them out as much as you can for abduction. That looks great. And bring them back neutral position. Good. And then you can put your hands like this and point your thumbs to the ceiling and then point them towards each other and then away from each other. Perfect. And looks good. Oh, and opposition as well. So go ahead and touch each thumb to each finger. Awesome. Now we can move back to the you can get back on here. And you can do the lower extremities. So I'm inspecting, I'm on the right side of the patient while I'm inspecting the hip joint, the anterior superior iliac spine, the greater trochanter, and I'm also going to palpate those areas since I'm here. So the ASIS, the trochanter, the hip joint, hip joint. Oh my god. And then I'm going to move on to The lateral medial femoral condyles, I'm inspecting those, as well as the patellar joints, and the patellar joints, and the tibial tuberosity. So medial and lateral condyles look good, and the patella joint, and the tibial tuberosity. Okay, great. And now I'm going to go to the lower legs and the calf. So I'm inspecting the Achilles tendon and the malleoli, as well as the metacarpals and metatarsals, metatarsal bones, as well as the toes and the interphalangeal joints on the toes. So I'm going to go ahead and palpate those areas now, palpating the malleoli, the Achilles tendon, the metatarsals, the phalanges, and then the calcaneus. And then I'm going to go ahead and check your range of motion. So go ahead and lie completely flat, and I'm going to have you try and push your feet down, and then pull them up towards you. Perfect. And then I'm going to have you relax, and I'm going to move your ankles. Okay. Great. That looks good. And then I'm going to go ahead and palpate the interphalangeal joints. Okay. And your toes. So I'm gonna go ahead and I'm gonna hold this for you. Go ahead and like point your toes down, and then spread them. Okay. Go ahead and bend your knees for me. Okay, so I'm gonna go ahead and check. So we're gonna do hip flexion right now and extension of the knee. Perfect. Great. And now we're gonna do adduction and abduction, and then but this was internal rotation and external rotation. Yeah. Oh, and I stabilized the hip. Okay, abduction and adduction. Okay, and then I'll do the other side. So lift this up, bend the knee, flex, extend the knee. Perfect. And then abduction and adduction, and then internal and external rotation. And then I'm going to go ahead and have you flip on your side towards me first, and I'm going to check this hip's extension, and then flip to the other side. Okay, and extension. Perfect. And flip on your back. We are going to check the calves. We're going to go and check the size of the calves. And also the knee range of motion, so the size of the calves from the tibial tuberosity down to the greatest part of the calf. I'm going to make a little marking here so that I know. And then I'm going to measure this. I'm measuring and making sure that the right calf is the same as the left. Okay, I'm going to do the same thing over here. Okay, good. And right there. Perfect. And then I'm going to go ahead and use my goniometer to check the knees range of motion. Should probably open it. I am using the go ahead and flex your knees as much as you can. I am checking the range of motion, making sure the goniometer is in line with the trochlear, greater trochanter, and the ankle here. And it looks like it's about 40 degrees. Perfect. And I'm going to do the same thing on the left side. Flex your knee. Okay. Perfect. That's good.